Hello, everyone, and welcome to this audio podcast. In this series, the LabTronix series, this is the Shientist, and once again, this is an audio podcast that's as part of the Ballistix Edition. This is an RPSG and KDOS collaborative and in line with a Storm Robotics production. And today I'm going to provide an audio podcast in and around surgery and renal biopsy. So to begin with, in context of renal biopsy, a renal biopsy is often necessary for diagnosis, prognostic assessment, and therapy guidance for disease management post-transplant. And a renal biopsy is relatively a safe procedure with a well-defined risk profile, enabling patients to make shared decisions. Now, renal biopsy generally can help deliver specific molecular and cellular patterns of disease. And there's works going that's been evidenced by several authors in and around biopsies. Um, so renal biopsy can be a main sort of procedure to characterizing chronic kidney disease, and is an essential part of disease management, as per mentioned. But also, biopsy allows the initiation of appropriate treatments with the view of slowing down chronic kidney disease progression and ultimately avoiding patients where they go from CKD, chronic kidney disease, into full-blown end-stage renal disease. And so renal biopsy can also help facilitate bedside to bench research that further defines mechanism and pathogenesis of disease and potential avenue for new therapies or new sort of pharmaceutics as well. So, in addition, I want to mention a few sort of objectives around a renal biopsy in sort of a bullet point, from a bullet point perspective. So, unexplained, acute or rapid progressive. Where there's unexplained or acute or rapid progressive renal failure, where there's evidence where patients have nephrotic syndrome and a significant non-nephrotic proteinuria. So, for example, there can be a diagnosis where patients may have a form of nephrotic syndrome, but alongside that nephrotic syndrome, where a renal biopsy can be useful, where there's sort of significant sort of proteinuria that is not necessarily linked to the disease itself. And so there's also sort of biopsies can be useful in sort of persistent glomerular to determine persistent glomerular hematuria, or where there's sort of ongoing sort of bleeding through the urinary tract. And also systemic diseases with with general renal involvement, and of course one of the main objectives around sort of renal biopsy is to determine whether there's evidence of renal allograft dysfunction. And so renal biopsy also the general procedure is where a renal biopsy should include at least, in literature it varies, but it's at least where 10 glomeruli are sort of are extracted from the kidneys at the time of the procedure, and the minimal sample size for diagnoses varies depending on the underlying diagnoses. A biopsy sample requires or needs to be processed under sort of light and electron microscopy, as well as something that is referred to as immunofluorescence. And the current standard procedure, or at least the documented procedure for renal biopsy, involves the use of real-time ultrasound to guide an automated spring-loaded biopsy device. There's in a line to the procedure, computated tomography guided renal biopsy has been a sort of an alternative imaging modality to the procedure. A renal biopsy is usually performed in a prone position or a supine position. However, if a patient has difficulties or has challenges breathing, for example, then in context of preference, then the supine position is more appropriate. And biopsies also are usually performed after ultrasound implementation, marking or underlying sort of renal, the real time the real time imaging in aligned to sort of ultrasound guidance in this regard. There's also something that's referred to as a laparoscopic renal biopsy. So this is where a renal biopsy is is conducted under sort of direct vision, and the methodology allows positive identification of the renal system for a macroscopic diagnosis. A laparoscopic biopsy has sort of many advantages, including reduced wound infections, safe and reliable, and potentially more accurate way of diagnosis, and supporting aspects of sort of follow-up in regards to for example, where a patient may have problems in and around the kidneys, around their renal pathophysiology. However, it also requires in some aspects the practice around renal biopsy can differentiate. So some places, some professionals may choose to use, for example, local anesthesia. Some may use general anesthesia, depending on the extent of diagnoses, and is generally where it can be more invasive. Can be laparoscopic. Generally, laparoscopic renal biopsy can be in some regards more invasive than the percutaneous biopsy procedure. And there's also something that's referred to as transjugular renal biopsy. And so transjugular biopsy is performed in an angiography, in facility where there's an angiography, and an internal jugular biopsy is performed under ultrasound guidance, and the right side is preferential in this regard, and a biopsy needle is generally inserted into the renal vein, into one of the renal veins, and the tissue sample is obtained with the aid of a spring-loaded sort of gun, a spring-loaded gun, and it is generally a safe technique, as a needle passes into a vein and away from major vessels, minimizing bleeding as well. And so I'll highlight just a few points around the limitations of this. So a renal biopsy provides only a cross-sectional, snapshot image of renal pathophysiology at any given time, and based on the overall clinical picture, the clinician has to sort of weigh up the relative advantages and the potential toxicities of therapy, and not just for example, take into account the specific renal pathology aspects of the procedure. So in context of safety surrounding renal biopsy, computed tomography guided renal biopsy can expose the patient to the risk of radiation, albeit the risk of radiation would be quite small, and hematuria and sufficient bleeding may lead to blood transfusion request, and aligned to this, ultrasound techniques are generally part of renal biopsy care plans as well. Pre-biopsy desmopressin appears, or at least in literature has highlighted to appear to have a role in reducing the bleeding complications post renal biopsy. In context of research, apart from there being the practical bases of what might warrant a renal biopsy, in context and relating to research, renal biopsy is not only advantageous to CKD, chronic kidney disease, or end-stage renal disease clinical management, but can better establish the epidemiology of disease and direction of treatment procedures. In specific patient groups, renal biopsy is more often considered and generally accompanies best practice. And again, there is evidence in the literature to highlight this. So some of the biopsy complications. So the main complication of renal biopsy is bleeding, but additionally there can be evidence of silent hematoma or detectable on post-biopsy imaging, macroscopic hematuria, blood loss necessitating, for example, blood transfusion requests, and uncommonly more severe bleeding require angiographic intervention, and also worst case scenario is where there can be full removal of a kidney, also known as nephrectomy. So in context of renal biopsy and pregnancy, so pregnancy is generally not a contraindication for practitioners and nephrologists, for example, to carrying out a percutaneous renal biopsy, and generally a renal biopsy can be conducted to defer the procedure until can be conducted, but can also be deferred until, for example, the postpartum period or duration, unless it may change management before delivery. And transcutaneous renal biopsy in the prone or supine position is can be technically challenging in females in pregnancy, where females are in the third trimester, and renal biopsy in the elderly. So evidence suggests that in specific clinical settings, renal biopsy often provides clinical, diagnostic, and prognostic information, and changes treatment as many as 40% of elderly patients. So performing renal biopsies in very elderly patients is not associated with a greater risk of complications than in younger patients. However, it is valuable as a diagnostic tool that should be actively considered in can be actively considered in elderly patients, giving the appropriate indications and clinical settings that maximize potential benefits or advantages. So renal biopsy and in regards to in around some sort of additional aspects around diagnoses. So in a number of scenarios, renal biopsy can be used as an adjunct to clarify or support a diagnosis support a diagnosis suggested by the results of other investigations. And in patients presenting with urinary abnormalities such as hematuria and or proteinuria, a renal biopsy will will help confirm sort of the histological characteristics compatible with a diagnosis. And diagnostic crosstalks is a sort of a result of renal biopsy and other clinical investigation, and is particularly important in the setting of renal transplantation and antibody mediated rejection. And the histological or histopathological findings on renal biopsy influences the prognosis of a choice of potential particular or potential therapies. And here I'm now going to just highlight really around bone biopsy in CKD or those who have a suspect or risk of mineral bone disease or abbreviated as MBD. So bone biopsy is gold standard to evaluate bone turnover, and bone biopsy is known but less frequently utilized because it is generally an invasive procedure, and one that requires highly skilled professionals or personnel to interpret tissue samples. And also repeating bone biopsies for monitoring evaluation on sort of bone turnover is generally, or at least in literature, has been documented or evidenced as impossible. So the use of multiple bone biopsies as gold standard for diagnosing and monitoring a renal osteodystrophy, for example, is useful, but it can be quite impractical. And so there, once again, I just want to highlight a few acknowledgements. This brings us to the end of the audio podcast. In this overview, and the acknowledgements are here in relating to the colleagues and collaborators in an effort to co-develop the slide set here. Colleagues from an academic institution, and also the Renal Patient Support Group, the RPSG, and also the Kidney Disease and Renal Support KDARS for Kids organization. And once again, this has been an audio podcast on in and around the LabTronix series, and this is a part of another Storm Robotics production. Thank you.